We are gathering here today to witness a very important day in the history of health services in South Africa. We are making history today as we are officially launching our national vaccination campaign against cervical cancer here in Mangaung. Today marks the beginning of an effective prevention against cancer of the cervix of the uterus. I announced this in the budget speech in May 2012, and I said this vaccine is very expensive. If you go to a private doctor now, or any private hospital, you are going to get it, but you will have to part with between 700 and 1,000 rand for each dose. But I promised then that we are going to negotiate hard and very hard for our people to get this vaccine free. Women in all countries are at risk of getting cancer of the cervix of the uterus. However, it is women in developing countries who bear the heaviest burden and who suffer the most. The severity, the complications, the human suffering, the loss of life, all this is worse in developing countries and poor resource settings with limited access to early screening, treatment and management of complications. The World Health Organization has produced guidelines for eligibility for HPV vaccine. The World Health Organization suggests that girls between the ages of 9 and 13 will benefit from this vaccine. This aims to give protection to girls long before they are exposed to this HPV, not HIV, HPV infection. We in South Africa, we decided to start with grade 4 because they are typically 9 years of age.
The struggle against cancer, in particular breast and cervical cancer, and those two diseases are not subjects which is close to my heart. They are in my heart. It's a struggle that I decided to take on since 2009, when I realized that so many of our women were dying painful deaths from the two leading causes of, from the two cancers among women, and that is breast and cervical cancer. South Africa today is witnessing a huge milestone, a step towards the right direction, which is prevention is better than cure. I must congratulate Minister Motsoaledi, being backed by the government of the day, for having taken bold steps in dealing with the diseases that are competing for his attention on his desk.